I'm Ken Lanfear. It is 8:40, a special edition of our Bronson Health Chat now on the topic of COVID-19, the new strain of coronavirus, the rise in cases here in Michigan. Lots of people wondering what they can do to keep themselves and their families safe. Dr. Gregory Tiongson is a pediatric critical care physician and the medical director at the Bronson Children's Hospital, and he is joining us to talk about the virus and especially what parents need to know as they deal with it. And joining us here on WKZO this morning, Dr. Tiongson, it's a pleasure to have you with us.
Good morning, Ken.
Good morning. Thank you so much. First of all, if you would kind of, we're so focused on don't do this and don't do that, but maybe we just need to define coronavirus and what symptoms look like.
Sure. Yeah, absolutely. There's a lot of information out there about coronavirus and specifically COVID-19. Just briefly, coronaviruses have been around for a long time. They are essentially a cold virus. What's specific and different about this particular strain is that it's new. It's not something that we've seen before, and so there's a lot of us who haven't had any built-up immunity to it. Likewise, it seems to cause, in some people, more severe infections, and so those two things make it a special infection that we need to be especially on guard for. The symptoms tend to be like cold symptoms, but COVID-19 tends to be more specific for having fever and having respiratory symptoms. And some folks do have some GI symptoms at time. One thing that I've noticed as I look at the data, and I was just looking at the data for Michigan this morning, and there's about 1,000 cases so far in Michigan. There's only about 1% that are children. So kids seem to have, for whatever reason, to be less, at least of the tests that we've done so far and the patients that have gotten testing and found to be positive, children seem to be a little less apt to have the infection or at least to be as symptomatic as other folks.
Well, kids, of course, are home with schools closed, and parents not only are making sure that they're safe, but also have to try to keep them entertained during this period of time, and that can be tough. Yes,
absolutely. And I think, as a nation, we've heard a lot, we've seen a lot about what can we do to protect ourselves, and there's really only two things. One is having good hygiene about washing your hands, and the other thing is social distancing and trying to limit the spread of the infection. There are times, kids included, who may be asymptomatic and have this infection, and the less that we are in contact with people around us, the less likely we are to spread it to someone who might actually become sick, who might be at risk. And so the more that we can do to limit how many other folks that we come in contact with, the better.
Dr. Gregory Tiongson is with us from Bronson Children's Hospital on WKZO this morning. You mentioned kids' reactions to coronavirus versus adults. Can kids be carriers? Is there a danger there to, say, older members of the family?
Yeah. I would say that, yes, kids can be carriers of asymptomatic infection. In fact, that probably explains why, or my guess would be why there's only 1% of the positive cases have been children, because most of those kids who may have this infection aren't symptomatic and they aren't needing to be tested. They aren't someone that we're doing testing on. So definitely kids can be carrying this around and be asymptomatic. And the biggest concern with that, of course, is that they could come in contact with someone who is at risk. We do know that older folks, grandparents, and other of the older folks in our community are at risk. We know that folks who have chronic diseases like heart disease, diabetes, and kidney disease are especially at risk as well. So, children and us, other young, healthy adults who could also be asymptomatic carriers. We need to do our part to limit how this virus gets spread through our community and try to keep it from getting to the vulnerable populations that live around us.
Kids are naturally curious, of course, and they've got questions. So what advice do you have for parents when talking to their kids about what's going on?
Yeah, I think, kids, they really depend on us, right, to be calm, to be clear about what we communicate with them and be reassuring. I mean, I think it's fair to tell them that there's an infection going on. I think it's fair to say that there's a cold virus, that almost everyone is going to be just fine, but we need to do what it takes so that other folks don't get sick. And I think kids will understand that. They don't like being sick. They don't like having a running nose. They don't want their friends or their other family to get sick. So, but the biggest advice I can give you is just to be as calm and as clear and reassuring as you can.
Dr. Tiongson, if someone suspects they might have the coronavirus, what should they do?
Yeah, I think it's really important that as people get sick, as we feel ill with fever or respiratory symptoms, that we try to keep that infection from spreading to other people. So for the most part, if you are just mildly ill, you should stay home. And if you feel sicker and you need to hear from your healthcare professional, then you may need to call your doctor. And doctors' offices and hospitals, they want people who are sick to be seen. But we want to do that in a place where it's going to be safe for you and the other people around you. So most folks are asking people to go to specific places. And at Bronson, if you're a Bronson patient or connected to Bronson Hospital, there is a phone number that you can call. It's called Bronson Care Advisor. It's 341-7788. Of course, the area code is 269. And they can help direct you towards where to get evaluated so that it can be done safely, and even possibly where, if you need any testing, that might need to be done. Of course, that information is on our website at bronsonhealth.com/coronavirus COVID-19.
Dr. Gregory Tionson's been with us, pediatric critical care physician and medical director at the Bronson Children's Hospital, and providing some very valuable information for us this morning on this special edition of the Bronson Health Chat. And Doctor, thanks so much for taking time to be with us this morning.
Yep, thanks, Ken. Wash your hands.
Will do. News Radio 590 and 106.9 FM, WKZO.